This webcast and any accompanying materials are copyrighted by the American Association for Respiratory Care. Any public display, sale, copy, or distribution of the video or materials may only be undertaken with the prior written consent of the AARC. Copyright 2016, all rights reserved. My name is Shauna Strickland. I'm a respiratory therapist, asthma educator, and the Associate Executive Director at the AARC. I welcome you to today's presentation, Campus to Career, Crucial Steps for Moving from Student to RT. Upon completion of this AARC webcast, participants will be able to state the importance of professionalism, recognize the value of professional engagement, avoid common job application blunders, discuss how to successfully interview for your dream job, and state the importance of retaining NBRC credentials after graduation. I am pleased to welcome Ms. Dana Evans. Ms. Evans is a registered respiratory therapist, neonatal pediatric specialist, and manager of respiratory care at Mercy Children's Hospital in St. Louis, Missouri. She is active with both the Missouri Society for Respiratory Care and the American Association for Respiratory Care, currently serving in the AARC House of Delegates. Ms. Evans has been involved in developing student mentorship programs at the state and national levels and continues to mentor students directly in her work environment in the Missouri Society for Respiratory Care and in the House of Delegates. Ms. Evans has no relationships to disclose. I disclose I am a paid employee of the AARC. Brand names of products may be mentioned only as examples of technology. Dana, welcome to the program.
Thank you so much. Can you hear me, Shauna?
We can, thank you.
Wonderful. Just wanted to say thank you to the AARC and to Dr. Strickland for having me today. Very excited to spend some time chatting with students about the importance of being professionals and moving from a classroom environment to the hospital environment on a professional level. As Dr. Strickland mentioned, mentoring students is a great passion of mine. So again, very excited to be here with you guys today. So to begin, I want to talk about professionalism and the importance of being a professional, not only in the clinical environment, but in other clinical and other professional locations, and how important this is when we think about presenting our best selves, not only to other respiratory care students and respiratory therapists, but hiring leaders and leaders in our field. It has been said many, many times, I'm sure you've heard this, that you never get a second chance to make a first impression, and that is absolutely true. Those moments that we spend with other professionals, those first moments, that opportunity that they get to meet you is often the impression they're left with for a very long time. And first impressions are very difficult to overcome, particularly if they're negative. So it's important to take every opportunity you can to show your best self. I want to talk specifically about clinical rotations. So commonly, students will forget that a clinical rotation in a facility, particularly one that you might want to work at, really is a job interview. Hiring leaders will definitely assume that the behavior you display for them in the clinical environment is how you will behave as an employee, for better or for worse. I can tell you as a hiring leader, most of the issues we see with students in the clinical rotation absolutely continue on once we've hired them. So if those are some significantly negative attributes, those individuals would likely not be hired and might not even be granted an interview. Even if you don't have an opportunity to engage with a direct hiring leader during a clinical rotation, be aware that those preceptors and folks you engage with in the units absolutely talk to the manager, and the manager talks to the preceptor. If they are receiving an application from a student they know has done a rotation in their hospital, they most commonly will reach out to those clinical instructors and ask them, is this a good fit for our institution? Do we think we should hire them? Do you think I should interview them? So it is very important to treat every rotation like it's a job interview. You want to make sure that you're engaged in clinical care. ask lots and lots of questions. And first and foremost, be respectful and courteous of everyone you engage with. You should treat the hospital CEO with the same level of respect that you would treat the housekeeper, patients, visitors, guests, anyone you encounter. Sometimes people will ask me, you know, does it really matter if I don't think I want to work at this facility, or I don't intend to work in this particular avenue of respiratory care? Let's say you're doing a sleep rotation and you know for sure you're not going to do sleep. Does it really matter how I present myself to that group of people? And the answer is absolutely yes. Truth of the matter is, respiratory care, while there are a lot of us, and it is a very tight-knit and small community. You want to make sure that you're maintaining enthusiasm and professionalism at all times, because you never know when the person you're engaging with in this environment is close friends with or colleagues with a hiring leader at another institution that you do want to work at. In truth, you may change your mind and ultimately want to work at that facility later in your career, a year, 2 years, 5 years down the road. Or, as so often happens, people change jobs. So the hiring leader at the sleep lab where maybe you didn't show your best self might now be the hiring leader at the level 1 trauma center that you want to work at. And they will remember a non-professional student. So it doesn't really matter if you intend on working there or not. You need to always be presenting your most professional self. You don't have to take my word for it. This was the AARC recently sent out an ask to AARC members about what they thought were attributes of really exceptional students or things that turned them off and made them say, oh, no way, I don't want to hire them. And they actually made that available on the AARC website on the career advice section. But I wanted to show you some direct quotes from AARC members about how they felt about students and some of the things that they felt were important to them, so you get a wider view of what others think of this. So in Ohio, we have a therapist who wants students that are pleasant and friendly, working towards gaining confidence, folks that do not come out being defensive or offensive, so they're working closely and a good team member with not only therapists, but a multidisciplinary care team. Folks that are enthusiastic, have good clinical knowledge and skills, and again have strong teamwork skills are important. We like it when people show interest in gaining extra knowledge, things that are beyond just the objectives on the paper that they have to get checked off for this class, but really want to be engaged and learn more about the patient in front of them. What they don't like are students who are whiners or complainers, bring personal baggage to clinicals. We all know that outside of the facility, not everything is perfect all the time, and you don't have to be 100% every single day. But you should not be bringing complaints about how difficult your coursework is, or how unfair your program director is, or a lot of personal baggage into the hospital. People just don't want to hear that. And then, of course, you do not want to engage yourself in the muck that can be departmental politics. You don't want to engage in that. You want to make sure that you're above that at all times. And certainly, this is a personal pet peeve of mine, students that must be on their smartphone at all times, are texting during a conversation or looking at their emails during rounds. That's a huge, huge no-no. Aside from the fact that cell phones are disgusting from an infection prevention standpoint, they have lots of germs on them, it is absolutely unprofessional to be engaging in something other than your clinical work while in a clinical facility. Being on time and looking professional. So students that routinely arrive late to clinical are probably going to be therapists that routinely arrive late to work, and we pay very close attention to that. The flip side to that is you don't want to be the one bolting out of the door immediately at the time that clinical is over. We want you to be excited to be with us. It may be true that you're dying to get out of clinical because maybe you've got somewhere to be or you've got homework to do, but your preceptor should not notice that. You should be really excited about being where you're at. And sometimes that may be staying over a little bit if you're engaged in a bronch, for example, or some other special procedure. And the other thing that makes me absolutely crazy, and certainly lots of others, is I've already done that, I don't need to do it again. So you've already seen procedure XYZ, you've already gotten it checked off, you never have to see it again. That tells me that you really don't find this to be an important skill, an important piece of knowledge to gain, and likely that you may not find other things important either, or that you just aren't going to be that coworker that would go above and beyond for our patients. That may not be true, but bear in mind that your actions in clinical very much are reflective of whether or not you'll get an interview and or be hired in the future. So while I find it absolutely imperative to be a professional in the clinical site, it is also very important to maintain professionalism when you're attending professional events. One of the most common things students attend over the course of their school year that would be a professional event would be a conference. So maybe you're attending a state or local conference of your AARC affiliate, and maybe you're with your students class or you're alone, but you want to make sure to remember that hiring leaders and folks from institutions all around your state or your region will be there as well. And they always have a watchful eye on students, whether or not you're aware of that. If you want to make sure that you're dressing appropriately, certainly the expectation here is not that you wear a suit, but you shouldn't come in and cut off shorts or a mini skirt and flip-flops. You want to look the part of a professional, and you want to be attentive during the presentations given. So I have definitely looked to my left and found students who are sleeping during the event. That's not a great thing. You know, it's possible that you were up really late the night before, or you didn't go to bed, or maybe you haven't been to bed yet. Well, at one of those events, lots of fun things going on, but you need to be present during the presentation. So you want to be respectful of the presenter, and being asleep certainly is not respectful. You also want to avoid having excessive side conversations. If you feel you must have a conversation with someone at your table, you really should take that ideally outside of the room so as not to distract other attendees or the presenter. That's really, really distracting to others. You want to make sure you don't do that. And of course, these events, while professional, are absolutely fun to attend, and there are often great activities afterwards. So we want you to have fun, but you need to remain respectful and don't drink heavily. Most of the negative things that I have seen with students at conferences have started with over-drinking. You know, I'll tell you one story of a student who was very woeful about their drinking. They were on a dance floor. We had a DJ. They were on a dance floor having a good time with their friends. And next to them were two women who were also dancing and having a good time. And one of the women inadvertently bumped into the student. The student who had been drinking too much turned around and started yelling and shouting and trying to start a physical altercation with this person who, again, accidentally bumped into her. What she didn't know was the woman she was yelling at was a hiring leader at the major level 1 trauma center that their school does clinicals at. The hiring manager asked where she went to school, and then ultimately that student was not allowed to even do clinical at that rotation because she felt that if she displayed that level of unprofessional behavior, that she should not be allowed in that department and to have access to their patients in that area. So you can imagine she also would not have gained employment at that institution. So just bear in mind that in interactions like that, you don't know who you're talking to, but certainly not only was she engaging with a hiring leader in that way, I saw that interaction, as did many other hiring leaders, so that's a negative connotation for sure. And probably most important, more important than almost any other thing here, is to be professionally engaged. We want to know that you have a stake, a passion for our profession. And being a member of the ARC definitely shows that to me, shows me that you're ready to go, that you're looking forward to the future, that you want to be an advocate and engaged in who we are as professionals. So it certainly is an expectation that you would be a member of the ARC and or your state affiliate. It does stand out on your resume. You should include that. That's something I look for every time I look at a resume. And that doesn't mean I won't hire you if you're not a member, but certainly it gives you a leg up if you are, because that tells me you are engaged, you're passionate, you're enthusiastic, and this profession is important to you. As a student, there are many, many ways to become involved at the local level. I strongly encourage you to seek out your state affiliate leadership. If you don't know who they are, I would look for their website. Most state affiliates have a website readily available to you, or ask your program director who they should contact on the board. So many opportunities. Every state is a little bit different, but many of them are in the works or already have established student mentorship programs, opportunities for you to meet and network. Networking is so important with other professionals around your state. Our state has a student liaison program where we encourage and engage students to come to our board meetings and be involved in the planning of our community events and state conferences. Some states have opportunities for students to give presentations at conferences, scholarships, awards. If you can get involved in a legislative day, that's huge. What a wonderful thing to be able to put on your resume that you advocated for our profession with your local elected officials. So I would encourage you to try and get engaged as much as possible. Other opportunities for engagement are volunteerism and other community events. Ideally, those that are related to healthcare. If you can find something that's related to a respiratory therapist's heart, like a Better Breathers Club, the CF Foundation has CF walks and bike rides that you can become engaged in. The American Lung Association has lots of opportunities to volunteer, asthma camps, etc. So really looking for ways to engage yourself and show us as hiring leaders that this profession is important, our patients are important, and you want to grow as a person and as a professional. So I can't have a conversation about professionalism without talking about social media. It's so pervasive in our communities today. Everyone seems to have some method of social media, be it Facebook, Twitter, Instagram, LinkedIn, you name it. Always some ways to be communicating with one another. But it is really important to be thoughtful about what is available, particularly on your public profiles, to hiring leaders. Lots of thoughts that social media can hold you back, and particularly if you have inappropriate comments or photos on your website. I wanted to draw to your attention this Harris poll performed in 2015. They surveyed about 2,200 hiring leaders and human resource managers and about 3,100 adult employees, asking them questions about social media. And I want to tell you that 52% of the responding hiring leaders said they looked at social networking sites or search engines to research their candidates to decide whether or not they would either interview them or hire them. So if you haven't Googled yourself in a while, you might consider doing that and seeing what's out there and looking at what's available on the internet about you, in particular things that you or your friends may have posted on social media. And you might be thinking to yourself, well, that's all fine and good, but healthcare managers probably don't do that. Well, guess what? About 49% of healthcare managers actually do this. I certainly am one of them. And I can tell you that there have been folks that we have declined to interview because of what I have found on their social media websites. In fact, 48% of those who said they use social media said they chose not to hire someone based on what they found. Many different things that they're finding on those websites, including inappropriate photos or bad-mouthing of previous employees or your school. Be cautious about what I might be able to see. I'm not advocating that you get rid of things. What I'm saying is take a hard look at that site and say, would I show this picture, comment, etc., to my hiring leader? If the answer is no, you probably shouldn't have it up there. And I just want to make a brief comment about Facebook pages being private. Bear in mind that if someone shares my photo and they share that photo or that comment, that does become accessible to a much larger audience, potentially folks that you did not want to see it. And also, about 35% of the employers in that survey said they actually sent a friend request or asked to follow the prospective interviewee, and they agreed. So everything on that site then became available to them. Some of them then said they didn't hire them because of what they were able to see. So be careful about who you're accepting as well if you want to keep things private. I'm going to talk really briefly about LinkedIn because it is a social media site designed specifically to showcase you as a professional. This is definitely not required of a respiratory therapist, but if you do use it, make sure you're using it correctly and that it is a professional site. Well, you know, it's wonderful to know that you're an avid horseback rider or you love your doggies. That's probably not the right place to showcase that. The profile pic on your LinkedIn account should be a professional photo of you, not of your puppy dog. And just bear in mind that any political conversations or controversial topics really should be kept off this site because it is available to anyone and everyone who would choose to look at it. The good news is, it's not always bad what they find on their websites. 32% of respondents actually said that they hired a candidate because of what they found on the internet. So perhaps their social media site showed them doing some wonderful volunteerism work and they thought that made them fit in with the culture of their institution and they went ahead and interviewed and hired them. So you can use it to your advantage. Just make sure you're doing it the right way. Now this I love. 15% of the applicants said that they flipped the tables and used social media or an internet search to look up some information about the person that was interviewing them, the hiring leader that would ultimately be their boss should they be accepted. I think this is a great idea. You can learn more about the person and perhaps you might find out you don't want to work for them. So I just think this is a great little bit of advice and kind of a neat thing that folks are doing. So just takeaways about social media. You want to make sure that your online presence is positive and professional. If there's anything in there that you don't want folks to see, you make those private and separate your personal and professional presence on the internet. Okay, let's talk about the meat and potatoes here, online applications and resumes. Really, really important. You want to get that dream job. You want to move on and get a job in the profession you've been working so hard towards. So I want to talk first about position selection. So when you're on the web and you're looking at different institutions in your area, places you might want to work to see what jobs they have available to you, make sure that you are reading the entire job posting and the description completely. You want to ensure that you are not accidentally applying for a position that you're truly not qualified for, because ultimately that's a waste of time. You won't ever get a phone call, you won't ever get an interview, and you may wonder why. A great example of this, and one we certainly have seen here, is it may be your dream job to work on a neonatal air ambulance transport team, but many of those require experience in critical care. So here's an example of one where it would require 5 years of previous critical care experience. You would not want to apply for that as a new grad because you'd be immediately weeded out and would never even make it through to the interview process. You're much better off to apply for a staff therapist or something that clearly doesn't require previous critical care experience. I do often get asked by new grads or soon-to-be new grads, you know, how do I apply for these positions that require the RRT credential, which obviously they don't have because they haven't graduated and have not had the opportunity to challenge that exam. Can they apply for that? Absolutely, you can apply for that. I encourage you to do that. That's certainly what you're working towards, and you don't want to wait and miss an opportunity because you didn't apply for that position. However, a lot of online application systems will go through and see you don't have a license in the state and you can't because you don't have a credential, and you don't have the credential in the state and you can't because you haven't graduated. And it will weed you out automatically. The computer will weed you out. So I always tell folks when they're doing that, make sure that you have a conversation with the hiring leader, ideally face-to-face, or it could be email or a voicemail, letting them know that you're intending to apply at their institution. And that way they can keep their eyes open, or contact their human resource leader and tell them I'm looking for an application from Ms. Smith, and so it can be sent over and it doesn't get weeded out. The nice thing is you can also get a feel for the hiring manager about whether or not they want to hire you. Of course, the flip side is if I know you're one of those students that I don't want to hire, I'm probably not going to ask the human resource manager to filter you out anyway, which goes back to making sure that you're professional all the time. The other thing you want to make sure you do when you're looking at the job description is to look at and make sure you differentiate between the required and the preferred qualifications. So an example of a required qualification would be holding licensure to practice in the state in which you want to work, or the RRT credential, for example. A preferred qualification might be a bachelor's degree in health sciences, or in a neonatal facility it might be obtaining the RRT-NPS credential from the NBRC. Those are preferred. It does not required. So even if you don't have the NPS credential, but you are an RRT or working towards that, you are absolutely able to apply for that position. I hear folks that don't apply for positions because they didn't have the preferred qualifications. That's just silly. You might get the job. You absolutely could get the job. The other thing that's important about looking at preferred qualifications is it gives you insight into what the hiring leader really wants from you. So if you know that a preferred qualification for this job at a Level 1 trauma center is an RRT-ACCS credential, when you're interviewing for the position, you can tell the hiring leader that it is your plan within the next 1 year, 2 years, 3 years to challenge that exam. And that'll give you a leg up in the interview as well. So just kind of be attentive to that. It gives you rare insight into what the hiring leader really wants from an ideal candidate. But don't let it prevent you from applying for the job. Now this is big. Follow the instructions. Take the time to actually read and follow the instructions for the application. It seems silly that I would have to tell you that. Believe me, this is a common problem. Read and follow the instructions. If there is a question that application is asking you, answer it. Don't leave spots blank. Some of these online application systems, if there's a blank answer, it'll just throw you out. And if it asks for a resume, make sure you include one. In fact, I'd go so far as to tell you that if it gives you an option to include a resume, you really should, because that'll give you an opportunity to show a broader view of you. These online applications are wonderful, but they often just ask for your name, your address, your license, your credential, where you went to school, and where you've worked recently. It doesn't give a full picture of some of the things that you'd really like to highlight about yourself. So when we talk about cover letters and resumes, that is the difference between what you put in an online application and a resume. An online application is the bare bones minimum, who are you? But a resume really gives you an opportunity to showcase yourself and stand out above others who may have applied. And when we talk about a cover letter, do I need one? Should I put one in there? How is this any different? Some hiring leaders are very adamant that you absolutely must include a cover letter, and the absence of a cover letter would suggest you're not super interested in the job. Others don't feel as strongly about that and are okay if it's there or not. I would tell you always, always include it. You do not know if you're interviewing with someone who's adamant that they have it or is laid back about it. So make sure that you include a cover letter and take time to draft one of those. What is a cover letter? What does it include? It's essentially just, again, an opportunity for you to say, I am interested in this position, and I can bring a lot to the table for you. You want it to be clear, concise, respectful, and professional. So here is an example of a cover letter for Mr. Buterol. You can see at the top there, that's the header. So that's your hiring information. You'd like to try and get the information, the specific information for the hiring leader you're meeting with and include that on the letter, and avoiding the to whom it may concern as much as possible. If you don't know who it is, this is not a curse. You can put to whom it may concern, but it's certainly more personal if you can put their name. And the body is just a brief introduction to you, highlighting your strengths, what things you can bring to the table. Please make sure someone proofreads this. You don't have typos or grammatical errors. That's a big red flag if you don't take the time to really read through this. And of course, the closing should be respectful. And you always want to make sure you leave a nice spot for you to physically hand sign this letter. When it comes to resumes, some of the same stuff. You want to have your contact information. An objective statement is always important. This highlights what you plan to bring to the facility, not what I'm going to give you as a hiring leader, right? If I'm the hiring leader, I think my place is pretty great, so I know you're going to get a lot from me. What I want to know as a hiring leader is what you are going to bring to our department, what value you're going to bring to our patients, our therapists, and our team, and how you're going to enhance the culture that we already have. So what can you do for me as a hiring leader as opposed to what can I do for you as a student? You want to include, of course, your education. Any special courses you may have taken. Maybe you did a side research project or a class on research that no one else in the area does. You want to include that, including your GPA. If it was good, I would never advise putting a poor GPA on a resume, but if it was a good one, that would be great. If you graduated with honors, that's always wonderful to include here. A section on licenses and certifications. So when you've got that RRT in your hands, make sure you put it on there. If you've got specialty credentials, the NPS, the ACCS, and then any American Heart certifications or others that you may have should be included there. And then work experience, of course, particularly. Now, we know as a new grad you haven't worked a lot as a therapist. Certainly, maybe you've been a student respiratory therapist. But if you had a job previously that showed customer service or that you engaged with people, that's really great to talk about here. And if there's specifics you want to include about the role, like did you train new people? Did you do the schedule? Maybe you were involved in service recovery or interviewing or any of those things that are really, really important to customer service, which is vital in the hospital as well. You could highlight those here. That might give you, again, a leg up on someone who maybe has never had to do something like that. Clinical experience. This is an optional thing. Some students do like to include clinical experiences, particularly if they're very proud of where they went. That is absolutely fine. If you wish to include clinical rotations you've had, you can include that on the resume, but it must be crystal clear to the hiring leader, the person reading that resume, that that is a clinical rotation as part of school and not a job that you've had. I definitely have read resumes where I'm looking at it, wondering why this therapist has changed jobs so many times in the last year, because it was organized poorly, but what it really was they were telling me about their clinical rotations. So good to include if you wish to, just make sure it's very, very clear that it's clinical rotation as part of your respiratory care program. And of course, I mentioned this before, professional affiliations. Write down that you're a member of the AARC. Include that you're a member of your state society. And any student associations or offices or special projects that you held is great. And then volunteer activities, including honors and awards. If you speak another language, that's great. Be sure that you're fluent in it if you put it on here. I speak like 3 words of Spanish, but I would never put Spanish on my resume as a language I speak. And again, when you're looking at a resume, it should be clean, concise. The formatting should be consistent, very easy to follow, very easy to read, no bright splashy colors, no bright splashy paper. You want to be very, very clean and neat in this. So you don't want to use fancy or exaggerated fonts or colors. Some are really, really difficult to read. You definitely don't want to exaggerate your skills or job history. I recently read a cover letter for a soon-to-be graduate, and he, in that letter, mentioned that he had experience, had gained, I think he even said tremendous experience in critical care intensive care units. And, you know, I stopped him and I said, there's no way you have tremendous experience in critical care intensive care units. You're a student. But you can say that you've been exposed to, done clinicals in. Be careful about how you use words like that. You know, someone who maybe has a 5, 10, 15 years in the job market can tell me they have extensive or tremendous experience in critical care. So be careful not to over-exaggerate what you're doing. Again, make sure someone reads this for you. I encourage you to read it yourself, but I also encourage you to give it to someone else who's never seen it to read it too. So often our eyes have read something so many times, we know what we think it means, but there might be a typo or a grammatical error there that someone else will catch. So make sure you have someone else proofread that for you and just use that valuable opportunity. It could be your program director, it could be another student, it could be your roommate or significant other, someone else to read that. Again, consistent formatting is key here. The margins should be the same font size. You want to make sure when you come to the interview that you have a physical copy of both the resume and the cover letter. I would suggest having more than one. And make sure that it's not on bright pink or floral or scented paper. You want it to be on regular printer paper or resume paper if you want it to be more robust. And definitely, this seems like an obvious thing to say, but you need to be prepared to have a conversation about anything that you put on that resume. So make sure you're ready to talk about it. References. You do not have to include references on a resume. Very likely you're going to have to include references in an online application. Make sure before you list someone as a reference, you talk to them. Again, this seems obvious, but I can't tell you how many times I get a phone call, email, letter requesting a reference from someone I don't even know is applying for a new job. And especially if it's your boss. I probably don't want to find out that you're leaving our institution because I've gotten a reference request from another neighboring hospital. That's not great. So make sure you get their permission, make sure they know what they're applying for, and make sure you know what they're going to say. It's surprising the number of folks that have asked other leaders, teachers, etc. for a reference, and what they say isn't positive. So make sure you know what they're going to say. You might be surprised to learn that we've had folks that maybe wasn't the top employee ask for a reference. And in good conscience, you can't give a good one. So you have to be careful about who you're asking and making sure both, one, that they know you are applying for a job, and two, you know they're going to give you a positive reference. The pre-hire assessment. This is something that is sort of new to the marketplace. Lots and lots of institutions are using a pre-hire assessment. It is just a little online exam or screening tool that often happens before you can submit your application or sometime after you submit your application. And very commonly it's used to determine if you are eligible to move forward in the interview process. Lots of companies out there do this. Some of them are looking at clinical knowledge specifically, so it might be a very clinical-oriented exam. The new sort of ideology around this is to look at more a behavioral or a culture fit. Will you fit into the environment that we've created here? Again, lots of places do this, lots of companies doing it, a lot of money in this. And the reason, things that we're looking at here is, are you able, do we think you will provide quality care, you're a good communicator, that you're going to do the right thing at the right time, and that you're a good critical thinker. And you might think, well, why on earth would we do this? Is this the best way to sort of determine this stuff? There is some literature around this that says employers that utilize pre-hire assessments have a lower incidence of turnover, so less people quitting, less people calling in, happier employees, happier patients, and higher HCAP scores. And if you're not familiar with HCAP scores, that is the post-discharge survey that patients take. So it's a reflection of our satisfaction scores and directly related to the amount of money that CMS or the government gives the hospital. So very, very important thing to focus on from a hospital executive leadership perspective. That's these things right here, super important in terms of bringing on the right person. So these companies are touted as being able to help you choose the right person for the department that you have. You cannot really prepare for these, and I don't think you should be have tons of anxiety around it. What I will tell you again is that you need to read and follow the instructions. Very commonly we have folks that tell me they have applied and we've not ever found their application, and I go back and I found out later that it's because they did not complete the assessment. If you didn't complete the assessment, I'm not even allowed to talk to you. So that may mean that you did part of it, or you skipped it entirely. That's not good. Or perhaps you got a very low score on it. You want to make sure that you look and see how much time this is going to take and allot that time to get it done. You want to answer and read every question. I've had folks that have scored poorly on these exams, and we go back and we look and they spent 20 minutes on the doggone thing, or 10 minutes on a 30-minute exam, and so we know that you just click through it very, very quickly. So you might say, well, you know they went through it quickly and probably didn't read all the questions, so they probably are better than that. But I don't know if I care, because you didn't take the time to complete our application process. So make sure you read every question and dedicate time to that. But you shouldn't freak out about your answers. Just be yourself, but make sure you actually do this thing. Now, when you make it to the interview round, this is a big deal, right? You're very excited. You want to work at this hospital. You've made it all the way through. You want to move on to your professional life. Let's make sure we don't blow it in the interview. So first and foremost, arrive on time. And in fact, I would tell you to arrive early. You want to make sure that you allot time to find a good place to park. Hospitals are hard places to park, and a lot of them are big and confusing to get around. So make sure you arrive early to get yourself situated, ready to go, and are on time to meet the person you're supposed to meet. Nothing is more upsetting than someone who arrives late or doesn't arrive at all. If you don't arrive at all and you haven't communicated with us, unlikely we're going to schedule another interview with you. You want to dress professionally. This does not mean that you have to buy a suit, but probably business casual is the way to go. So for men, this is dress slacks, a shirt with a collar, ideally. For ladies, that could be, again, dress slacks and a blouse, or a nice skirt and a blouse. You want to make sure that you are professional and not overly casual. Definitely you've had folks walk in the door in flip-flops and shorts. That's not how to get a job. So you want to make sure that you're dressed in a way that, again, conveys your best self. Now, ladies, I want to tell you that I love shoes and I love my high heel shoes, but you want to make sure that you're wearing comfortable footwear and that the clothes you're wearing are comfortable so you're not uncomfortable while you're being interviewed. If you're uncomfortable, you'll be fidgety, and that may convey yourself in a negative light to the interviewer, or maybe you're uncomfortable or anxious, but really you're just uncomfortable because maybe your skirt's too tight. So you want to make sure that you're comfortable in the clothing that you're wearing and you look professional. Some places will make you take a tour after you've interviewed. So you want to make sure you have footwear on that allow you to walk around that giant hospital and not be uncomfortable. Please don't come in smelling like cigarettes or heavy, heavy perfume. You may giggle about that, but that absolutely has happened. I'm a respiratory therapist, so I'd like you to know that how you smell is important here, so don't come in reeking of tobacco. And please, 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 leave your cell phone in your purse, in your pocket, turn it off. I don't want to hear it ringing. Please don't answer a text message while you're being interviewed. That's bad. People do it, though. And of course, you want to be kind and courteous to every single person you encounter. Very commonly, we'll have a secretary meet you in the lobby of our institution. Lots of places do this, I'm sure. Because we're such a big place, we don't want you to get lost. So we will speak to the person who picked you up to make sure that you are kind and respectful to them. So treat everyone, every single person you encounter during an interview, even if you don't believe it's part of the interview, is part of the interview. So if I send you on a tour with one of our therapists to show you around the ICU, I'm going to talk to them after. So you want to make sure that you're engaged and are aware that all of that's part of your interview. And of course, bring a copy of that resume and cover letter. Come prepared. You want to research the hospital you're interviewing with and learn as much as you absolutely can. If their respiratory care department has a special part of the hospital website, or they've achieved some certification levels, you want to know that because you want to be able to address that and talk to it in the interview, and then that way the hiring leader knows that you're engaged in the facility. And perhaps you've done a social media search of the person that you're talking with, so you can learn more about them as well. You want to be prepared to answer commonly asked interview questions. So healthcare is, your skills in healthcare are so very, very vital. But I often tell people that if you aren't the strongest person on APRV, for example, we can teach you that. But if you are not a good fit in our culture, or if you're not a good customer service person, that's harder to teach. So it's very important to be able to bring examples of times you provided excellent customer service to someone, ideally a patient. So think about a time that you went above and beyond for a patient, a family member, a physician, a coworker, and be prepared to share that story with us, because very commonly they're going to ask you a question about how you provide excellent service. You want to be prepared with an example of a difficult clinical situation and how you worked through it. So that might be about a time you had to terminally wean a patient and how difficult it was to engage with the family. Or it could be an example of a patient with severe ARDS that you had to really critically think to get them oxygenated. And how did you do that? Very commonly we'll ask you something you're proud of. Could be something you did in respiratory school. Could be something you did in your personal life. That's okay. An area of a weakness. I have a love-hate relationship with this question, but this is a very common interview question folks will ask you. So there are ways to kind of bomb this question and ways to really excel. So the most common answer, I'm a perfectionist. Well, that's great. That's you trying to tell me your weakness is a positive, probably. I'm a perfectionist. I'm very detail-oriented, etc. So that's probably not an ideal example of a weakness. So really think about where you need to gain strength. So for you, it might be that you don't feel strong as a neonatal care practitioner yet. This does not surprise me. That's okay to talk about that. And if this is a children's hospital you're applying at, if you don't feel super strong in that avenue, what you say is, this is what I'm doing to improve that, or I look forward to having an opportunity to gain knowledge and skills in this area by working in your institution. So be forthright about that. Don't do the canned, I'm a perfectionist answer. And most importantly, think about what you can bring to our department. So if you're an excellent communicator, or you feel like you're great with patients, or a fast learner, those are things to talk about. But really, customer service examples are key. Many managers will ask you why you became an RT. This is them trying to learn about you. And then, of course, a lot of them will ask about hobbies or special interests. I mention this because you want to make sure you don't list anything controversial. You don't want to be seen in a negative light because you've mentioned something that could be of controversy. Prior to completing your journey as a student is getting your NBRC credentials and challenging those very important board exams. And we'll tell you right out of the gate that you need to get your RRT. Those students who only get their CRT very commonly have put a cap on their growth as a therapist. Many leaders will not hire and will not even interview a CRT. Now, if you're a CRT because you just challenged the CRT and you haven't had a chance to challenge the clinical simulation exam yet, that's okay. But if you're a year out or 2 years out or further and you haven't challenged the RRT exam, I have to wonder why. And I wonder why you haven't done that. And I start to question about whether or not you're truly engaged in the profession, truly engaged in yourself as a lifelong learner, and are going to be the right fit for our institution. Aside from that, as a CRT, you're probably not going to have a lot of upward mobility, so you must get the RRT. That is truly the future of our profession, and get it as quickly as you can so you don't have to worry about it. And once you get the doggone thing, you want to keep it. We're going to talk about that in a minute. If you feel like, but when we talk about credentials, if you feel like you want to work in adult critical care or neonatal and pediatrics, or if you want to be an asthma educator, I strongly encourage you to make it part of your career plan to get those advanced credentials. This shows me that you're motivated to grow in this area. It shows me that you are committed to adult critical care and that you're so impassioned about it that you went out and you challenged that exam and you gained that credential. So I strongly encourage you to go out and do that and take that extra step. Again, once you've earned those credentials, you don't want to lose them. All of the NBRC credentials that were gained after 2002 have a 5-year timer on them. So they must be renewed every 5 years with the NBRC Continuing Competency Program, or CCP. And I have to tell you that if you lose these, they can be very difficult and costly to get back, so don't lose them. One of the most common reasons folks don't renew their credential is because they have moved and they forget to tell the NBRC. The NBRC starts sending out reminders to you 1 year prior to the expiration of your credential. But if you've moved, you're not going to get that. So anytime you move, and certainly as a new graduate, you're going to move at some point. So make sure that you get on the NBRC website and update your mailing address so that you can get those vital reminders about your credentials so you don't inadvertently forget to renew, and then be in a tight spot where you don't have a credential. If you don't have a credential, you certainly can't work at our institution, and many places are like that as well. There are 3 options for renewal. The first and easiest is to provide proof of completion of 30 hours of continuing education to the NBRC. One of the really cool and new things the AARC just did, which is awesome for our members, is you can have the NBRC pull your AARC transcript, and it will automatically dump in all the CEUs you've earned through the AARC. So it's just a couple of extra clicks. All the work is done for you. Very convenient. Lots of hard work on behalf of the AARC and NBRC to get that done. So just an awesome opportunity for everyone. If you don't want to do that, you could retake the exam. I don't know a lot of people that are super excited about retaking the board exam, but you could do that. And then the third option would be to challenge a higher level exam or an exam you haven't taken before. So if you are an RRT and 2 years later you successfully challenge the ACCS exam, it not only jumpstarts the 5-year timer on the ACCS, but it resets the 5 years on the RRT. So it makes them at the same time. So it automatically renews that RRT for you. So that's a nice thing, particularly if you plan on taking those specialty examinations. Being a member of the AARC, as I said, shows me as a hiring leader that you are engaged in our profession. But there is so much that the AARC does for you, not only as a student, but as a professional once you've graduated. When we talk about job searches in particular, their website has some amazing information designed specifically for folks that are looking for jobs, and there's a section just for new and recent grads to give you really great career advice from professionals who have been in your shoes before. You can see on this screenshot the conversation about the NBRC credential renewal. Lots of stuff here about jobs. People post positions on the AARC website. And this is a screenshot actually from the Students in recent grad page with all the different articles available for you at $0 just to look at this and get some great advice from folks all around the country. And I mentioned briefly earlier in the talk resumes and cover letters. There's more information right here on this site to talk about how to grow as a professional, how to write a resume, how to, things about social media. So I strongly encourage you all to take some time and get on the website and look at these really great resources available to you. Did you know that as an AARC member, you can get $40 off that NBRC exam that you take. So when you sit down to take the written exam, if you register through the AARC website and you are a member, you get $40 off. That's outstanding. The AARC also makes available to you a large number of free continuing education options in order to maintain not only that state license you have to maintain, but your credential as well. And this is awesome as a soon-to-be new grad. The AARC has available to you NBRC self-assessment tests to help you prepare and identify areas of weakness. So when you challenge that exam for real, you're more prepared and more able to do so and hopefully able to pass it on the very, very first try. So just to kind of summarize, I know we did a lot of little things here. Just to kind of summarize what we've talked about here is, of course, hiring leaders want to bring in the absolute best people in their institution. We always want to find the person that's the best fit and can bring the most to our department and to be very professional, not only as a student but certainly as a graduate. So you want to make sure that, again, that you're very, very professional in the clinical setting when you're doing clinical rotations and when you have the opportunity to network and engage with professionals at professional events. Those clinical rotations are very, very long job interviews, and you should treat them as such. When you take the time to apply using an online application and doing the pre-hire assessment testing, make sure you read and follow all of the directions and take your time in completing those. Absolutely become a registered respiratory therapist. This is so important and really is the key to your future as a therapist. You want to identify the area in which you want to specialize and make a plan to work towards obtaining those advanced credentials and certifications. Make sure the NBRC knows where to find you and they have your address so that you can always maintain those credentials. You never want to lose those. And the AARC, most importantly, is not only your partner now, your partner in continuing education and career advice and resume writing and professional advocacy, and I really could go on and on. They're your partner today and really for the rest of your career. So membership is absolutely vital in making sure that you're in the know about what's going on in our profession and being a step ahead of those who are not. So make sure you maintain your AARC membership so that you can be at the forefront of our career, of our profession. That's all I have. So with that, I will turn it back over to Dr. Strickland.
Thank you, Dana. That was wonderful. There's so much great information. And we have so many folks who have a lot of questions for you. So I have kind of grouped these questions into three major areas. The first area that I want to talk about is student employment. If I get hired as a student respiratory therapist while I'm in school, would that put me at a future advantage for employment either with that facility or with another facility?
Oh, I'm so glad someone asked that question. Yes. So I think if you have an opportunity to become a student therapist at a hospital, you should seize that opportunity, because this gives you a chance to have a job and earn money, and that's wonderful, but also gives you an opportunity to learn, engage, and network with professionals around you. So strongly encourage you to consider that. In terms of whether or not that improves your chances of getting a job, that depends on you. Definitely have seen student techs take their job seriously and really just be a no-brainer. We're going to bring you on, we're going to hire you. And others who don't take the job very seriously and sometimes treat it like it's their cashier job that they had, and we know they're not going to hire them. They don't, they aren't motivated, they aren't working hard, they come late. So it can be a negative or a positive, but I would encourage you to seize that opportunity and use it to your advantage by being a dedicated employee. And absolutely, yes, it does give you a leg up in the career market, particularly if you've done a good job.
Thank you very much. The next group of questions has to do with your references. So if I followed your advice and I talk to folks and I get somebody's permission to be a reference for me, when I put that onto my resume, onto my application, how much weight do they carry, really, in the context of the application itself?
I think that depends on what they say. So if I've interviewed you and I think you are a shining star, a reference that tells me that you are a shining star obviously is a nice addition to what I already know. But if they have negative things to say, that can bear some weight. So it is uncommon that we make a hiring decision based on the reference alone. But if you are a person who I'm on the fence about, maybe I can't get a good read on you, or the hiring leader just isn't sure, then they go to the references. If the references are stellar, we might err on hiring you. But if they're not so great, that's going to dump in the other direction. So I think they're actually most important when you're kind of a middle-of-the-road candidate. And
is there a preferred number of references that I should be prepared to obtain?
I think most online application systems actually ask for 2, if not 3 references. Just kind of depends. So look at that when you're making that decision. I don't want 25 of them, but 2 or 3 is usually pretty good.
So that's a really good point. You said in the online application system. So should I put my references on my resume, or should I just add them into the online application?
For me personally, I don't need them to be on the resume because they're in my computer system. You're welcome to include them. You don't want to take up a lot of space on your one-page resume with names of other people to talk about how amazing you are. You want to use your resume to talk about how amazing you are. So I would say that if you've included it in the online application system, that's probably okay. You might want to keep a separate Word document away from your resume that includes that contact information in case the person who's interviewing you physically asks for a copy of that. But I don't think it needs to be included in a general resume request if you've already done it as part of the application process.
Thank you, Dana. Let's move over to the resume. What is the difference between a CV and a resume?
That's a good question. So a resume is generally a brief look at your experience. It's 1 page, 2 pages at most. A CV is something that is a complete, almost biography of your career. This can be anywhere between 2 to 25 pages. I've seen some longer than that. That would include a whole host of information, including publications and presentations, etc. As a new grad, you probably aren't going to have a lot to complete a 20-page CV, and if you are, I don't know that it's value-added information. Most new grads do wonderfully just with a 1 or 2 page resume, so I would encourage you to go ahead and utilize that. Otherwise, you end up trying to fill in a lot of space with qualifications that you just don't have. We don't expect you to have them as new grads either, but I think a 1 to 2 page resume is perfectly acceptable for a new grad.
So if I have healthcare experience in another field, even though I'm a new respiratory therapist graduate, should I also add that healthcare experience from another department or another field?
Absolutely. Absolutely. That tells me you know what it is to work in a hospital environment, and likely you have some professional skills and service skills, and you're used to dealing with the environment that we're working in. So 100% you should include that.
And are there any keywords on a resume that may maybe exclude you or include you from an interview?
I don't know that there's a keyword that would automatically exclude you from getting an interview. I think when we think about the words that you use that would exclude you, often that is grammatical errors, poor, like I said, poor grammar, spelling, typos, things like that. That would probably be something that would exclude you. Like I said, things I like to see that really kind of shine a light on you are folks that have been engaged with their local state affiliate, have some good volunteer experience, are AARC members, and really show professional engagement. I don't know if there's one key word that I look for, but there are certainly key attributes that we look for when we're reading through a resume.
Thank you, Dana, for the presentation and for answering our questions. Unfortunately, we're out of time, but this has been a phenomenal session.
Thank you so much for having me. It's been a pleasure.
For those of you watching this as a live presentation, please stay with us during the next brief pause. If you're watching this program as an archive, this concludes our presentation.